So I'm just going to give you a very brief overview of Division 1, if I can work this. So the cancer research team, what the performance was like in 2013-14 and what our objectives are going to be for 2014-15. So I should probably start by saying that the cancer division includes hematological malignancies, paediatric oncology, and studies for solid tumours as well, such as breast cancer and colorectal cancer. Our divisional lead is Professor Nigel Bundred, who's a professor in surgical oncology based at Wythenshawe Hospital. Speciality lead is Dr. Andrew Wardley, who is a medical oncologist based at the Christie. We have a small core team based within the larger clinical research network team at Central Manchester. And importantly, we're lucky to have research nurses and administrators funded by NIHR in every NHS trust in the network. Move on. So just to give you an overview of the performance in 2013-14, this chart shows two things. It's the numbers of studies open and recruiting, and it compares each of the new 15 clinical research networks. And it also looks at the patient recruitment, but I'll discuss that in the next slide. So as you can see, if you compare along the bottom the red bars, which shows the number of studies, Greater Manchester has the fourth highest number of studies open and recruiting out of each of the 15 networks. This table shows a bit more clearly the recruitment position for each of the specialities. In the right-hand column, it shows you the number of clinical research networks that are recruiting to studies within that speciality. So for cancer, that each of the clinical research networks recruits to those studies. And I'm really pleased to say that the Greater Manchester Clinical Research Network recruits the highest number of individuals to cancer studies in 2013-14. And I'm particularly pleased about that because we're not the largest research network. We're about mid-table in terms of population, so we're really punching above our weight. And I guess this is a really good opportunity as well for me to say thank you to all those healthcare professionals and to the patients for this, because this wouldn't have happened without you. So just finally then from me, an overview of the objectives, the national objectives for cancer for 2014-15. Debbie's already mentioned the high-level objectives, which we'll obviously be working to, but there are new speciality objectives, and these are the 6 for cancer. So the first one is to achieve a minimum of 7.5% of individuals with a diagnosis of cancer or a pre-malignant condition participating in NIHR cancer studies. And when we've looked at the data for 13-14, we can see that actually we achieved approximately 11% against that objective. We need to achieve a minimum of 20% of individuals with a diagnosis of cancer taking part in any NIHR cancer study. And again, looking at the 13-14 data, we've achieved approximately 27% against this objective. We'd like every NHS cancer care provider to be recruiting participants into studies and to have a portfolio of cancer studies that serves the full range of our patient population, be it adults or children. So I'm pleased to say that those last two, we've actually achieved those again in 13-14. We'd like more shared care arrangements in place between NHS organisations so that we can offer more opportunities for patients to take part in research and to be treated closer to home where possible. We've started over the last few years looking at having more shared care working across the network, and that's something that we want to build on and improve on in the coming years. And finally, the last objective is to have greater than 32% of patients who are reporting that they've been offered participation in research through the National Cancer Patient Experience Survey. So the latest data that we have for that suggests that 4 of the 11 trusts NHS trusts within the region have exceeded that. So this is obviously something that we need to build on in the future. So I hope I've given you an overview of the cancer division and shown that we've got a really good basis on which to start and within this new clinical research network. We're obviously very pleased to be the highest recruiting network for cancer studies, and we would like to maintain that position. But we also have some challenges, and Debbie's mentioned obviously the recruitment freeze, and that's particularly a challenge for us. We'd like to work through those vacancies and look at how best we can support teams so that they have the correct infrastructure in place to support patients and give more patients the opportunity to take part in research.